Hey everybody, Dr. Dan here. Hey, just wanted to come to you guys with a quick video and talk to you guys about a topic that we talk about in the office every day with new patients and with our wellness patients, and it's a super important topic. It is the topic of care recommendations. A lot of times new patients will have questions about, well, why are the recommendations the way that they are? Why do we use these recommendations? Why can't I just pop in whenever I want to? That sort of thing. So I thought that I would just cover it with you and talk to you guys about that for a minute or two so that you can have some info on how we structure our care recommendations, okay? Number one, what is a care recommendation, or what we commonly refer to in our office as like a care plan, okay? Essentially what that is exactly what it sounds like. It is the recommendation based on what you're coming in with, what your spine appears, your nervous system, the testing that we do, how it all appears. We put that together and we come up with a specific recommendation for you based on where you are, where you're starting, and where we're trying to get you, okay? I can tell you that most of the time, 99.9% of the time, chiropractic, just like any other thing that you do for your health, whether it's exercising regularly, eating regularly, brushing your teeth, doing your stretches, whatever it is, it's not a one-time thing. If you want to get the maximum benefit out of chiropractic, you got to follow some sort of program. You got to follow some sort of recommendation, some sort of routine with it in order to get the maximum benefit, okay? So with every new patient that comes into the office, we always look at everything about them. Number one, what they're coming in with, what their complaint is, what their testing looks like, what their x-rays look like, and we put together the most specific recommendation that we possibly can for them, and that's what we present to them, okay? And then why is it important that we do this? Well, we kind of already touched on it, but just to give you a super simple example, if you were trying to get yourself into the best shape of your life physically, and you went to a personal trainer, and the personal trainer told you, hey, you know what, in order to get you from where you are right now to where you want to be, it's going to take you coming in here 4 days a week, and you're going to have to follow this specific program, you're going to have to do this specific diet, and we're going to do that for 6 months, and then we're going to reevaluate where you are, but you should be pretty darn good if you follow those recommendations. That person just gave you a very specific recommendation based on what you're presenting with and where you're trying to go with your health and with your fitness. We do the exact same thing. So if you go to that same trainer, you get that recommendation, and then you only follow 30% of what they say, you cannot logically expect to get to where he was projecting or she was projecting you were going to be. Exact same thing is true here, okay? If we look at your entire case and we say, hey, this is what you need to get from where you are to get you back to optimum health, 100% function, high quality of life, and you only follow 10, 15, 20, 30% of what it is that we tell you, then you cannot possibly expect to get to where you want to be. So following recommendations becomes one of the most important parts of this once we understand what's happening, okay? So I hope that helps you to understand why we don't just go at this haphazardly. Our ultimate goal for everybody in this office is to reach optimum state of physical, mental, and social well-being, for them to literally be functioning at their 100% best, or as close as humanly possible that we can get them, okay? And in order to do that, we can't go at things haphazardly. We can't just kind of shotgun it. We have to have a plan. We have to follow the plan. So I hope that helps, guys. And if you have any further questions, feel free to call the office, email us, post a comment. We'll get back to you. We love and appreciate you. Thanks.